Sex in seniors is an important part of health and well-being, but few people realize that the pills they take every day can have a profound impact on their love life. Did you know that blood pressure medications or antidepressants can reduce libido or make it difficult to enjoy intimacy? In the United States, where seniors often take multiple medications to manage chronic conditions, it's important to understand how they impact sexual health. On the Senior Health Channel, we explore how medications affect sex in people over 60, from common side effects to solutions to help you maintain a fulfilling love life. Find out how to keep medications from getting in the way of your happiness. Older Americans often face a variety of chronic health problems, including high blood pressure, diabetes, heart disease, arthritis, and depression. According to the American Pharmaceutical Association, the average person over the age of 65 takes 4 to 5 prescription medications every day, in addition to over-the-counter medications and dietary supplements. While these medications are necessary to manage a medical condition, they can cause side effects that affect sexual desire, erectile function, natural lubrication in women, and even the ability to achieve orgasm. However, many older adults do not recognize the connection between their medications and changes in their sex lives, or they are reluctant to discuss the issue with their doctors. This can lead to frustration, low self-esteem, and sometimes a complete abandonment of intimacy, which can reduce quality of life. One of the most common classes of medications used by older adults is blood pressure medications, such as beta blockers, such as atenolol, and diuretics, such as hydrochlorothiazide. These medications are very effective at controlling blood pressure, but they can reduce blood flow to the genitals, making it difficult for men to achieve or maintain an erection. In women, they can reduce natural lubrication, making sex uncomfortable or painful. Beta blockers are also known to reduce sexual desire in both sexes due to their effects on the nervous system and hormones. It is important to note that not everyone who takes these medications will experience side effects, but the risk increases when multiple medications are combined or as the body ages and becomes more sensitive to chemical changes. Antidepressants, especially SSRIs such as sertraline, Zoloft, or fluoxetine, Prozac, are also a common cause of sexual dysfunction in older men. These medications improve mood and reduce anxiety, but they can reduce desire, delay or prevent orgasm, and make it difficult to maintain an erection. For many older men, depression is already a barrier to their sex lives, and the use of antidepressants sometimes exacerbates the problem, creating a vicious cycle that is difficult to escape. This is especially worrying because depression in older men is often underdiagnosed, and many men only discover the effects of the medication when they notice a decline in intimacy with their partner. Diabetes medications such as metformin or insulin can also affect sexual health. Diabetes itself is a risk factor for erectile dysfunction in men and decreased libido in women due to damage to nerves and blood vessels. However, some diabetes medications can worsen these problems by causing fatigue, changing hormones, or reducing overall energy. Similarly, medications to treat high cholesterol, such as statins, atorvastatin, or simvastatin, while important for cardiovascular protection, can lower testosterone levels in men, leading to decreased libido and difficulty achieving an erection. In women, statins sometimes cause vaginal dryness, making sex less comfortable. Another group of medications to watch out for are those used to treat chronic pain, such as opioids such as oxycodone or hydrocodone, and non-steroidal anti-inflammatory drugs, NSAIDs. Opioids, often prescribed for conditions such as arthritis or back pain, can significantly reduce sexual desire and cause erectile dysfunction by affecting the central nervous system and reducing testosterone production. Additionally, long-term use of opioids can lead to dependence, which can further complicate sexual and psychological health issues. NSAIDs, although less likely to cause serious side effects, can also affect blood flow and cause similar problems in some people when used long-term. Erectile dysfunction medications, such as sildenafil, Viagra, or tadalafil, Cialis, are a notable exception because they are designed to improve sexual function. These medications have changed the lives of many older men, helping them regain confidence and maintain active sex lives. However, they are not a perfect solution. Viagra and similar medications can cause side effects such as headaches and facial flushing, or interact dangerously with other medications, especially heart medications such as nitrates. Furthermore, these medications do not address desire problems or psychological factors, and they do not work for everyone. In women, there is no widely approved equivalent medication to improve sexual function, although some research is exploring options such as flibanserin ADI for postmenopausal women. In addition to prescription medications, older adults often use dietary supplements and over-the-counter medications, such as antihistamines like diphenhydramine or sleep medications. These medications can cause dry mouth, vaginal dryness, or fatigue, all of which can reduce sexual pleasure and enjoyment. Dietary supplements, such as herbs that are marketed as energizers or sexual enhancers, often lack scientific evidence and can interact dangerously with prescription medications. For example, some supplements, such as yohimbine, can increase blood pressure, which is dangerous for people taking heart medications. So how can older adults manage the impact of medications on their sex lives? The first step is awareness. If you notice changes in your desire, ability to have an erection, or comfort with sex, don't assume it's due to aging. Take a look at the medications you're taking and discuss them with your doctor. Many older adults are reluctant to talk about sexual issues, but today's doctors are trained to handle these concerns sensitively and professionally. Prepare a list of medications you're taking, including dosage and frequency, and describe in detail the changes you're experiencing. This will help your doctor determine whether medications are the cause and suggest appropriate solutions. One effective strategy is to consider alternatives to your current medication. For example, if you are taking a beta blocker that is causing erectile dysfunction, your doctor may suggest switching to a different blood pressure medication, such as an ACE inhibitor, lisinopril, that is less likely to affect sexual function. Similarly, if an SSRI antidepressant is causing decreased libido, your doctor may consider switching to a Sheffield, an antidepressant that is less likely to affect sexual function, such as bupropion. In some cases, adjusting the dose or timing of your medication may also make a difference. For example, taking your medication in the evening instead of in the morning may reduce side effects during the day, when you may want to engage in intimate activities. In addition to working with a doctor, seniors can also take steps to improve their overall sexual health. A healthy lifestyle is the foundation. Regular exercise, such as walking, yoga, or strength training, can improve blood flow, increase energy levels, and promote hormone production, all of which support sexual function. A balanced diet, rich in fruits, vegetables, whole grains, and lean proteins, can help manage chronic conditions and reduce the need for medications. Limiting alcohol and quitting smoking are also important, as both can worsen erectile dysfunction and reduce desire. Open communication with your partner is also important. Sexual problems can cause tension in a relationship, especially if one partner feels insecure or rejected. Share your feelings honestly and encourage your partner to do the same. Together, you can explore new ways to maintain intimacy, such as focusing on emotional closeness, trying other forms of contact besides sex, or using products like lubricants to increase comfort. Couples counseling or sex therapy can also be helpful options for people who are having trouble navigating these changes. For those who live alone or are looking for new relationships, dating apps and senior communities are growing in popularity in the United States. These platforms offer opportunities to connect and build romantic relationships, but they also require caution. Prioritize sexual health by discussing your health history with potential partners and using protection, like condoms, to prevent sexually transmitted diseases. Community health services, like Planned Parenthood or local clinics, often offer low-cost counseling and testing, giving you the confidence to enter new relationships. One often overlooked aspect is the role of mental health in sexual health. Stress, anxiety, and depression can reduce desire and interfere with intimacy. Relaxation techniques, such as meditation, deep breathing, or mindfulness, can help reduce stress and improve mood. Participating in social activities, such as senior clubs, classes, or volunteer work, can also boost self-confidence and feelings of connection, which indirectly improve sexual health. If you are struggling with mental health issues, consider talking to a therapist or counselor who can help you address the emotional factors that affect your love life. Finally, remember that sex at 60 and beyond is completely normal and should be celebrated. Don't let medication side effects or age-related misconceptions keep you from enjoying intimacy and pleasure. With the right knowledge, communication, and support, you can overcome medication-induced challenges and continue to live a fulfilling love life. The Senior Health YouTube channel is committed to providing you with practical information to stay healthy and happy at every stage of your life. If you found this article helpful, please leave a comment, share it with your friends, and subscribe to the channel for more valuable content. Together, we can break down stereotypes and build a community of confident, healthy, and vibrant seniors.